as part of the Judiciary Act, stating the district court shall have original jurisdiction of any civil action by an alien for a tort only committed in violation of the law of nations or a treaty of the United States. Now, U.S. corporations will continue to carry out non-consensual clinical trials abroad because international clinical trials are hugely profitable and because consent is not. It can be quick and easy to include boilerplate in a protocol so that the proposed experiment appears ahead of time to preclude the possibility of becoming non-consensual. Pfizer staff did this for the Trovan experiment. But actually preventing non-consensual experimentation, especially in a different language and culture, is time-consuming and difficult and therefore expensive. In order to establish that the norm was sufficiently specific to meet the Supreme Court's SOSA requirement of universal, specific, obligatory, the Second Circuit asserted that there was a core of this norm, and the core prohibits experiments in which the subject has not been told he or she is participating in an experiment. The court also identified some information, disclosure of which was not core, but fringe. One might infer that pharmaceutical corporations could inexpensively comply with the core of the norm by disclosing basic information and ignoring the fringe information. But communicating the basic idea at the core of the norm, that this is research, may in reality be difficult, time-consuming, and therefore expensive for the corporation, especially in a host culture that has no concept of research or hypothesis. So the problem of non-consensual trials will persist. State responsibility for those corporate violations must be demonstrated under the Alien Tort Statute by means of 42 U.S.C. Section 1983 or by international law. Alien tort statutes often fail to sufficiently allege the requisite state action. Several features of this particular norm make demonstrating state action challenging. It prohibits only non-consensual experiments, not experiments that harm children or that are bad science or unethical or illegal in other ways. In addition, the norm is a prohibition conditioned only on communicative inaction. Now, the Second Circuit skirted these features of the norm, focusing on the overall unacceptability of Pfizer's experiment and the Nigerian state's general involvement in it. The court did not deal directly with whether any state actor actually